Now the Harris Health System is in crisis tonight, according to its CEO. We're talking about Bentall Hospital, LBJ, and many of their clinics.
The CEO tells us too many people are in their ER, and there's not enough staff to help deal with the increase in ER and COVID patients. Anayeli Ruiz spoke with him and breaks down what exactly is happening. Anayeli.
Well, that's right, guys. A sudden increase in COVID patients is clogging up the systems. They have a shortage in staff, and they say the next time you're headed to the ER, you can expect a long wait. A new COVID spike in our area is causing a strain on the Harris Health System.
We are not talking about a crisis a week, 10 days, 14 days from now. We are in a crisis mode today.
The CEO tells us they just don't have enough staff to deal with the increase in COVID patients, along with their normal ER patients.
In my LBJ hospital, more than 50% of the ICU patients are now COVID positive, which is a huge burden.
See, last year, the state sent 140 nurses to help with the pandemic. Right now, the state has sent 0. To help, they're shifting some workers around, and they're closing down 2 clinics by the end of this week. Valbona Health Center and Squatty Lions Health Center. The staff from these 2 clinics will be transferred to help the 2 hospitals.
Very closely monitoring our elective procedures, trying to see when we may have to pull the trigger on canceling some of those procedures as well, so that we can provide more staffing into our hospitals.
Bottom line, if we don't reduce the number of COVID infections coming into the hospitals, they say expect long waits in the ER. We're talking 24 hours.
We're going to have increasingly more people in the emergency room waiting for a hospital bed. And unfortunately, some of them are never going to make it to the hospital bed. That's what happened last summer. And unfortunately, I think that's what's going to happen this time around.
And how can you help? They say the best thing to do is to get vaccinated.
If you're not going to get a vaccine, for God's sake, at least wear a face mask. Protect yourself, protect your loved ones.
Well, the hospital system tells us they're working very closely with other hospitals here in the area to transfer patients as needed. But as the number of COVID patients increases, that availability becomes much more limited. And of course, the CEO says he did reach out to the state and to the federal government for additional help. Mia?
Let's hope they get the assistance that they need. Anayeli Ruiz, thank you. And we've reached out to other hospitals in the medical center. They tell us they are not dealing with any staffing shortages at this time, but they are also seeing a big increase in cases come through their hospitals.